This meeting is being recorded. Okay, it is 11 o'clock and we will get started with our webinar today. It's Ideas for Increasing Capital to Childcare Centers During the COVID-19 Outbreak. And it is going to be presented today by John Young-Shik Concklin.
Good morning, everyone. Thank you for coming to today's webinar in Ideas for Increasing Capital to Childcare Centers During COVID-19. Before we get started, just a few logistics for the session. We'll be taking a few polls throughout to gather feedback on what you feel the most promising ideas are. Those polls will automatically appear on your screen, so nothing to worry about there. Also, we have space for questions at the end, but feel free to type in questions in the chat box to create a log. And I promise that we'll get to each one of them during the Q&A. So just briefly about the Institute for Child Success. ICS is an independent, nonpartisan, nonprofit research, policy, and planning organization dedicated to the success of all young children. And we pursue this in 4 ways. We propose and implement savvy research-based policies, advise governments, nonprofits, foundations, and other stakeholders on strategy, facilitate knowledge sharing and ideation, and accelerate impact through solution building. Today's webinar will cover ideas for increasing capital into the childcare sector, a need we are all aware of, but now is exceedingly acute due to COVID-19. Earlier in the pandemic, in April, ICS completed a statewide survey of childcare centers. While the survey is not fully representative, only about 4% of all licensed centers responded. It does track with NACI and other statewide findings. We'll make this survey available to everyone at the end of the webinar, but just to level set a few baselines and top line findings from the report which led us to this webinar. So in South Carolina, there are 290,000 children under the age of 5, 200,000 of whom live in households where all guardians worked. In other words, 2 in 3 children under the age of 5 absolutely have to have childcare in order for their parents to work. The average salary of a childcare professional is $21,000, a wage we all understand is lower than it should be. And about 22,500 families receive some type of childcare assistance. This would be public assistance. From the survey itself, responses showed that 1 in 3 centers could not weather any type of closure, and almost half of these centers were closed at the time of the survey, which was late April. It was unclear what would be needed to reopen these centers, if that was even a possibility. And the average loss up to that point, only about a month or a month and a half in, was about $50,000 per center. Assumably that figure has increased, but we are unsure. So further, the sector serves about 33% of all enrollment. And by sector, we mean registered with DSS, licensed by DSS. The other 67% are in some type of facility that falls outside of that category. So these are the sort of top level findings that we have from the child care survey. And just to get a sense from you, now a month, 2 months later, we have our first poll. So we realized that we're now over a month old and many things have changed, and we'd like to get a general sense of the relevancy of this information. So a poll should pop up, just popped up for me, and it's just a yes or no. We appreciate your feedback. Thank you, everyone. Based on this information, we feel that the issue at hand is pretty clear. Setting aside PPE, personal protective equipment, testing, and other health-related issues, which are major and arguably more important, or at least equally important to quote-unquote reopening the economy, the most pressing issue for childcare, the sector, is cash on hand. As has been documented recently in national and local publications, a foundational piece to reopening the economy is childcare. Without it, reopening will only be partial. However, without capital, given the financial losses over the past few months, the childcare sector cannot function. So in other words, the childcare sector cannot hire or rehire workers. It can't purchase PPE or meet other DHEC standards that go above and beyond the normal costs. And also, in some instances, there may not be a financial incentive to reopen. And therefore, then without childcare, the economy will not function at capacity, it will fall short, and then as a result, government costs will rise due to public benefits. So the goal was to, in putting this webinar together, was to find ways of putting capital in the hands of workers with children or putting it directly into the childcare sector. So there are 100 ways to categorize these, but the path we've chosen is to break them up into two categories. The first being ideas that would put capital in the hands of families for the purpose of childcare. And the second category is ideas that would put capital in the hands of centers or center employees. And so we'll begin with individual families. So the first one probably will not surprise you. It is not a new one. It is simply to expand and increase the reach of the federal child and dependent care tax credits, or the CDCTC for short, which probably just say the whole thing aloud. So currently, as this tax credit stands, it is non-refundable, which means it only reduces tax burden. In other words, if I owe $100 to the federal government and I get this tax credit, which is valued at $300 for me, it will only bring down my taxable income down to zero. I won't get the rest of that money. So I wouldn't get $200, if that makes sense. So yes, so as it currently stands, this tax credit is 20% to 35% of costs up to $3,000 per dependent, or $6,000 for two dependents. This will make sense on the next slide when we get to it. That's just sort of the language that the IRS uses. And it only applies to children up to 13 and or dependents physically and or mentally incapable of self-care. So that's a lot of thick IRS language. I figured it was best on the next slide to just show you how it works out. So if we could advance to the next slide. Yes, so in this example, we are using a family of with one child who earns $43,000 per year, which is the income maximum in order to receive this tax credit. If this family spends the average on childcare in South Carolina, that amounts to $6,300 annually, which you can see in the middle column there. As a result, their CDCTC would be $1,200, again, non-refundable. In the right-hand column, if we were to use that same family, but make this tax credit 100%, that would theoretically impact this family's taxable income up to $6,300, a positive change of $5,100. Making this refundable would then put cash in the hands of that family specifically for childcare. So building on this idea on our next slide is that South Carolina also has a child and dependent tax care credit. And the way that it works is it's tied to the federal one. So anyone who qualifies for the federal credit automatically qualifies for South Carolina's, except for spouses filing separately. For those that do qualify, however, they receive 7% of whatever they received from the federal. So using the maximum federal claim of $3,000 that South Carolina will allow, South Carolina's residents who receive that full amount would receive an additional $210. And again, this tax credit is non-refundable. And so it only impacts the tax base. So if we move to our next slide, we can see how all of this works. So on the very left-hand column, we have the categories, and then in the column entitled Current, we'll walk through that one. So we're using this same family with one child that earns $43,000 annually, spends $6,300 a year on childcare, which is the South Carolina average, and then receives $2,100 from the federal CDCTC, which makes then the 7% South Carolina one $84. So the net taxable impact to this family is $1,200, $1,284. If we move to the next column, this scenario is if the federal tax credit has no change, but then we move the South Carolina tax credit up to 50% of the federal one. So again, $43,000 annually, spend $6,300, tax credit would remain the same at the federal level of $1,200, but the South Carolina one would increase to $600 in this scenario, bringing the net impact to $1,800. Again, if we make this, either one of these, refundable, then it's actually cash in the hands of families specifically for childcare. And then I'll just quickly sort of run through the next two scenarios. The third one, which is entitled Fed 100%, South Carolina 7%. This scenario paints out for this same family, if the federal child care tax credit were to move to 100%, but the South Carolina one was to stay the same. So $6,300, in other words, would come back to the family in reduction in tax burden, which would make South Carolina, which would naturally increase South Carolina's to $441. The net impact being close to $7,000. On the far right-hand column, we have sort of the moonshot, if you will. This would be as if the federal one were to increase to 100% and the South Carolina one were to increase to 50%. This would impact the family $9,500. And again, if any of these were made refundable, it's then cash into the hands of families. So one caveat with this is that I simply chose 100% and 50% because they were clean numbers. Any increase in these would significantly help and put capital back into this system. So moving on to our next slide, we have yet another, sort of the benefits of these. So the benefit of this kind of tax credit is that it offers an incentive for parents to use childcare. We have found that through the survey, parents have been expressing unease with childcare, primarily because of health concerns, which is very important. But beyond that, this would help to inject capital into the system and get parents and centers the capital they need in order to get the economy moving forward. It obviously helps parents get back to work and therefore improves the economy. And it increases enrollment in centers, which has a sort of doubling effect in that many centers are funded based on their enrollment. And as a result, on the child development end, child development is able to stabilize sooner than later. So those are just some of the benefits to this. There are, of course, many others, but I think we'll move to our next slide now. So the next slide here is another individual one, one that impacts the individual families. Currently, businesses, and it's called the South Carolina Childcare Program Credit. So currently, the way that this works is that businesses receive a non-refundable tax credit to provide childcare for their employees at their specific site or at a site of their choice, at a site of the parent's choice. In other words, if I'm working at, let's say, Amazon, for example, and Amazon could receive a tax credit for building a childcare center at their site in South Carolina. Or if they were to give me as an employee a benefit, a childcare benefit, they would also then receive a tax credit. So the way that this tax credit works is that if businesses were to build a childcare center at their site, they would receive 50% of the startup costs back in the first year. And then after starting operation, they get the lesser of 50% of their operating expenses or $3,000 per employee benefiting. And so this is the key for us here. If employees are to use it off-site, they would get $3,000. The business would get a $3,000 credit, but it is only allowable for nonprofit centers. So the idea here is to expand this credit to be refundable for businesses, to include QIRS enrolled centers, which increases the pool. And this effectively is employers buying employee insurance, but it's through a tax credit system. So there are 3 wins here. The government is able to support businesses through a tax credit. Businesses free up some capital that is specifically for childcare, and parents also get help getting their kids into childcare. And then of course the centers also increase their capital. So again, using the same family, we're going to move to the next slide, and we can see how this one begins to affect, how this one impacts families. So here we go. So yes, using the same family, we have this family that has 1 child, earns $43,000. And then on the left-hand column, we can see how everything currently works. So some of these numbers will look familiar to you. The South Carolina program credit is $3,000. And then the other 2 that we recognize. So currently, if this family were to receive every single one of these things, the net impact to them would be a reduction of $3,700 in a taxable reduction of $3,700. If we move to the next column, we sort of walk through, again, the same scenarios. Federal no change, South Carolina moving up to 50%, close to $4,000, and then so on and so forth. So I'll just sort of pause to have let everyone take in the figures. There is one note that I had a little bit of trouble calculating on this end, is that if families were to receive this child care benefit, depending on how they receive it, it would impact their CDCTC and therefore their South Carolina one. I could go into that, but it takes quite a bit of math. So we just assumed that they received everything, and they had a good CPA who took care of it for them so they could reduce their taxable burden to their maximum advantage. Okay, so, and again, these figures, the 50%, the 100% are just sort of arbitrary, just for the purpose of giving examples. Okay, so the next slide we have here, yes, we have our second poll, and it should populate, and we're asking you to sort of force rank these. It will help us outline next steps. Great. Okay, so it looks to be a pretty even split, although the federal CDC seems to be the most popular one. Great, thank you everyone so much for the feedback. This really does help us organize our work over the next bit of time. So moving on to the next slide, we have ideas for increasing capital into child care centers. These are, this section is of course focused on capital into the child care sector or to child care employees. The first 2 are fairly simple. So South Carolina has 2 credits on the book that incentivize private capital into businesses and or nonprofits that meet certain criteria. The CDTC, not to be confused with the CDCTC, is the Community Development Tax Credit. This one is typically utilized by individuals investing into credit unions or housing organizations. But we feel there's a strong case to be made for child care centers to be included into the definition. On the private side, on the for-profit side, the angel investor credit is also on the books, and it is exactly what it sounds like. However, in order to receive this credit, the Department of Revenue must approve what a quote-unquote qualified business is. So the same thing here, we feel that the case can be made. It's a simple matter of in expanding definitions to include childcare centers, be them nonprofit, faith-based, or for-profit, or anything, any type of definition. It is really just expanding these definitions to include those types of centers so that capital can flow in. So we do realize that some of these are big fish items, but we don't want to leave any corner unexplored. So the next slide is sort of explaining why these could benefit. So the first is that the idea is to expand the credits to include childcare centers. And the benefits to centers are that it incentivizes investment and donations into childcare centers beyond families simply paying for service. Childcare centers receive much needed capital, and just from a business side, income sources are then diversified, split between pay for service, other types of private support, and then we include investments. The benefits to investors in or philanthropic action is that diversification of their portfolio into a foundational needed economic sector that is actually needed in perpetuity. In other words, society is always going to need this economic sector, and it is only set to grow. And so, in other words, if we reframe the investment opportunity and offer tax credits and other incentives to make this investment opportunity, we feel as though everyone wins. So it also is an investment into a sector whose market is projected to grow, just like I said. And it actually is an investment into a sector that does not currently meet the full demand. In other words, there is lots of room to grow in this sector from a financial perspective. So the next one is aimed at professionals in the field. So we have been hearing from centers that are able to think about reopening, that bringing back workforce is an issue. This compounds the issue of attracting and retaining a workforce to begin with. So if we remember back to the beginning slide, the average pay is $21,000 per year. And because of this, we looked into what loan forgiveness looks like for childcare workers. And what we found is that there is something on the books, but it's just not funded. So this childcare loan forgiveness is different from what is generally understood as student loan forgiveness, in that it is on a shorter timeline. So student loan forgiveness can happen after 20 years of service in a nonprofit or government organization, whereas forgiveness for childcare workers can happen after 5 years. So the difference is that this program was on the books, but it has not been allocated money since 2005 at the federal level. So here's how this is how it currently works, although again, it's not able to be claimed. So the program was created to attract and retain more highly trained individuals in the childcare profession. Borrowers who met the criteria had 20% of their total student loans forgiven after 2 years of service. An additional 20% after the third year, so that brings it to 40% of loan forgiveness after 3 years of service. And then it rises to an additional 30% after the fourth year, and again after the fifth year. So if a person had a student loan, worked in childcare sector for 5 years, they could have 100% of their loan forgiven if they met some of these criteria. This is a wonderful program. It's a little convoluted, I will admit, but it simply hasn't been funded at the federal level since 2005. So we feel that this is a longer term solution, but it potentially could be grandfathered back in to include anyone who worked for 5 years, thereby providing an incentive to come back or start sooner. In other words, if this were to pass in 2022, for example, at the federal level, it would theoretically, we could add language that grandfathered and retroactively allowed people to apply and receive loan forgiveness as a result of coming back. Or we could increase the percentages over the next couple of years to incentivize workers coming back into the field post-COVID so that we can get the sector up and running again. So the last one that we have for you is the real moonshot. But it also is potentially the easiest, at least mechanically speaking. So the idea, admittedly, but theoretically it is possible, and it's effectively a private-public partnership using the financial system and wealth to bring about more wealth. Here's how it works. Banks put up low-interest loans for childcare centers. We're talking under 4% interest, to which centers apply. But these loans are backed and secured by the endowments of large philanthropies, which co-sign the loans with the childcare centers. So theoretically, while the philanthropies assume risk, the low interest rates allow centers to get back on their feet, bring income, and make payments. In addition, funders like United Way or other funders that provide funding for childcare have a financial relationship with these childcare centers through their allocations process, and an agreement could be worked out with regard to what would happen should payments not be made on time. I've seen similar things happen in post-recession, where funders were able to make loans, direct cash loans. This would not be making a direct cash loan, but the arrangement would be similar. So this is a little out there in that this is not something that is normally done in a nonprofit field or the social services field. But the more I personally think about it, this one stands out as the most impactful. One, gets money into the system quickly, and two, except no one actually has to spend anything. In other words, philanthropies don't have to find new cash to send out. They don't have to play the zero-sum game of what do we take money away from in order to get money into this, except they use their existing wealth base to create new wealth. Banks make a little money, which that's what they're in the business of doing, and childcare centers get the cash they need. Everyone wins on this one. So I think that brings us to our last poll. And again, we're asking you to force rank these. Okay, great. Thank you, everyone. So that brings us to the end and the Q&A session, and we are happy to field any questions or also hear ideas that you also might have for this type of effort. What is the best way? The chat box or?
If you have a question, please ask.
There was a question about sharing the poll. So 3 had an 85% favorable. So the community development tax credit, that would be expanding childcare centers, the definition to include childcare centers. Loan forgiveness was also at 85%, and the private-public partnership was at 85%. The angel investor credit was 69%. So all had interest, a supermajority, if you will. There's a question around the chances of passing universal childcare as a publicly funded service. Is Brian on the call? He might be actually the best one to answer this for us.
Okay, can you hear me without screeching feedback now?
Yes.
Okay. In terms of the viability of the enactment, I think there are 2 core questions involved in that. One is the funding, but 2 is also the structure of that. I think some of the things that are probably not viable are universally publicly provided childcare, at least not in the short term. And the vehicle that's probably best known is CCDBG, which stands for the Child Care Development Block Grant. And that funds economic supports to families who essentially those who would qualify for free and reduced lunch, but it's not fully funded to do so. And there have also been a lot of challenges with that program. So, for instance, there are some states in which they're not using all of the funding that's there, and they're also not meeting the need. So, so I think the bigger challenge for the viability of enacting that is the speed, because building consensus around how to provide that would be the real challenge, especially given the importance of mixed delivery in many states. And also there's a related issue around a lot of states, and even at the federal level, are considering things like, well, let's take it first by taking a chunk out of 4-year-olds. So let's do publicly provided 4-year-old preschool or 4-year-old kindergarten, depending on what state you're in. And as anyone who's in the field knows, you take away the 4-year-olds from the mixed delivery model, and all of a sudden the cost goes way up for the birth to 3. So I think that we're actually in a moment where the viability for the funding is a lot closer than we've ever been. For instance, there's a bill right now, there's a provision in one of the COVID acts right now, the draft, that would provide $50 billion for childcare. And to give you a little context on that, the current CCDBG funding is up to 2.5 or 4.9, somewhere in there. It's a lot lower than 50 billion. And so it would be a dramatic increase in that. Now, granted, that would, in some respects, be like pouring water into the sand given the economic impact of COVID. So it's not as if it would be trying to multiply the capital in the sector by tenfold. It's more like it would be trying to stabilize the capital in the sector. But that does indicate significantly increased political will towards this issue. And I think that's related to people are starting to see the difficulties of restarting the economy when 8 to 10% of parents can't go back to work right now. And in fact, there was an analysis of that nationally, that right now, if we are left going forward with the current capacity, the current COVID capacity of childcare, then our GDP will reduce by 8.4%, just from childcare concerns alone. And so I do think that there's that political will for the funding, but I also think that there are a lot of challenges in terms of how you deploy that to achieve it. And so that's what a lot of folks will be working through in the coming weeks.
Thanks, Brian. Stay on the line because there's going to be one more for you, but we'll sort of go in order here. So there's a question around any initiatives taking place in other states, and the asker would love to know if there's any states that have more proactively started this alternative funding conversation. So my initial answer is that I could not find any state that has passed anything, though state childcare tax credits, other community development tax credits, things of this nature are on the books on other states. I would have to imagine that someone is having this conversation, though the conversation doesn't usually make the news unless it is passed. Brian, are you aware of any movement along these lines?
No, though I would say that there's a lot of variation in terms of how much the state is already engaged in the issue. So there are states like Minnesota where they have nearly covered financial supports for 3 and 4-year-olds who would be free and reduced lunch eligible, for instance. Mm-hmm. Whereas there are states like South Carolina where we're under 10% of that. And so there's just a dramatic variation in that amount of capital infused. But John, I don't know of anything enacted that would be this more innovative avenue of finance.
Yeah. Thank you. Let's see, the next one, do we have a sense of which of these potential leverage opportunities would there be the greatest level of goodwill to move forward? So the answer is we have a hunch, but in terms of effectiveness, we think that this is a suite of solutions. There's not going to be one that sort of solves it for us. If we move short-term to long-term, the most quickly activated one is actually the private-public partnership, because these endowments already exist, because relationships already happen with banks, and banks can move much quicker than the state legislature, for example. However, that is not necessarily a sustainable solution, because we can't have philanthropies taking on loans indefinitely. The middle phase would be sort of the state legislation, and then federal, of course, takes usually longer than state, and sort of moving through them. But we think that it's a matter of getting capital both now and sustainably into the field to help it recover, and then be able to better weather something like this happening in the future. There was one other question around, Brian, I'll ask you to fill this one. Do you believe that legislators at the federal level are beginning to realize the scope of the childcare issue? And if so, who is providing leadership in the House and or Senate and or perhaps White House?
So yes, I think that this is the events since March have sort of brought to light in a salient fashion. And by salient, I mean politically salient fashion. I think a lot of members understood in the abstract, but their constituents weren't talking to them about it at the same level as they are now. But now you've got also the National Chamber of Commerce is saying, hey, we've got to do something about childcare. And so that's a dynamic that has changed a lot. So it's given power to those who have been leaders on these issues. On the Senate side, I'd say both Alexander and Murray have been relatively strong on these issues. Senator, I think they're still both the ranking and chair of the Health, Education, Labor, and Pensions program. On the House side, I'd say the House process is a little more leadership heavy on these issues. So the respective leaderships have been fairly engaged, though since Paul Ryan left, I'm not sure about who's sort of taken up the mantle on the right. Pelosi and Hoyer and Clyburn are all fairly solid on these issues on the left. And then at the White House, the champion for these issues has typically been Ivanka, who has at different times in the administration highlighted childcare as a core priority for her work at the White House. But all that to say, while those are sort of the personalities that kind of pop, every district is hearing about this from constituents, and that's true at the state level as well. The county where I happen to live, the neighboring county, just had one of their longest, oldest child care centers close and called their state senator to share why. So there are, and that's at the state level. This is happening across the country in every county and every congressional district and every state house district. So I do think that there's a lot more energy and attention being driven to this.
Great. Thank you, everyone. So I think that is all the questions that we have. Please feel free to reach out to me or anyone on staff, and we will make sure to get you an answer. And of course, we are happy to help think through any of these solutions if you are in a position of bringing some of these things forward. But otherwise, thank you so much for joining us. And please don't hesitate to reach out, and we will get some materials out to you very shortly. Thank you so much, everyone.
Thank you.